Hi, today I'm bringing you 3 amazing tricks to help you treat back pain. We know that at any given moment at least 10% of the world's population suffers from back pain. And if you work in a clinic, you know that a lot of people go to acupuncture to treat this kind of problems. So it's very important for us to be good at treating them. The tricks that I'm going to show you today are meant to help you improve the treatment that you are already doing and not to completely replace what you're doing. This is not a one-size-fits-all treatment, it's just something that you can add to what you're doing to improve your results. And stay until the end of the video because the last trick I'm showing is the one that will help treat the most difficult kinds of back pain and the kinds of back pain that most people struggle with. If you'd like to learn more about the techniques that I show in my videos, check out the courses I have available. I have balanced method acupuncture courses both in English and in Portuguese that you can purchase and learn about this technique. And so let's dive in with trick number 1, and this is meant to help you to treat lower back pain. And this is bloodletting bladder 40. Lower back pain might be the most common problem that brings patients to my clinic, so it's important for us to have a lot of tricks. I know that you probably already have good results either from classical TCM techniques like local needling or moxa, or if you're more advanced and you're following my videos, probably you already know how to use the $1 million technique for lumbar pain from the balance method. If you don't know it and if you want to learn more about the $1 million techniques, just let me know in the comments and I'll make a video about it. But now let's look at the bloodletting technique that might improve everything that you're already doing and improve your results. I know that you probably learned that bladder 40 is the master of the lower back when you were studying, and that probably you use it a lot when treating lower back pain. But perhaps you're needling it instead of bloodletting it, and I can guess that you're not getting the fantastic results that you should when using this point. And my advice is always bleed and not puncture this point. I'm going to show you here a video that might help you improve your bleeding techniques, because I know that bloodletting is a struggle for a lot of people because you've learned the wrong techniques in school. If you want to see a bit more about bloodletting, you can search for a video about bloodletting in my channel where I go deeper into it, but now I will just show you the technique I usually use on bladder 40. So as you can see here in the video, you will locate the point and look for a very superficial blood vessel around the point, even if it's not exactly in the classical points location. And then I'm using a 19 gauge needle, and you will rapidly do one insertion and just like that get a few drops of blood. That is all you need. This technique is amazing and it will help even with the most acute kind of lower back pain, even in those situations where people get locked in a position after doing some kind of movement that they can't get back up. If you do this, you'll get fantastic results. This is the first technique that I will do in most of the patients that come to see me for lower back pain. And now let's go for trick number 2, and this is meant for cervical pain. And this is a set of 2 master tongue points, 7701 and 7702. As you can see, these points are located over the Achilles tendon. I will typically do this on the same side as the patient has pain. And if you think about the image, we know that this area can represent the neck, the same way that in the arm you can have the head represented on the hand and then you will have the neck along the wrist. The same thing can happen on the leg, where you have the head represented on the foot and the area of the ankle and the Achilles tendon will represent the neck. And these points over the tendon are fantastic to treat both the bladder and the gallbladder, which are the 2 main culprits in most cases of cervical pain. Puncturing these points might be a bit scary because you must go through the tendon to get the full effect. This is something that if you learn Master Tongue, by now you probably know how to use these points. I will show you in this video, but if you are not sure how to use these points, you should find somewhere to do an in-person class and learn them with a Master Tongue teacher. As you can see, I'm here needling 7701. We will locate the point, place the patient, and then go all the way through the tendon with the needle. This is not more painful than any other point if done correctly. The patient might feel a small electric shock when you reach the point, but that's just the chi sensation that's normal in any point. These points are amazing for cervical pain. And if you're not using them yet, you should, because they will improve your results. And now let's go for trick number 3. And as promised, this might be the most important trick that you're going to learn today, because it is applicable to pain anywhere along the back, and it will help you treat one of the most difficult types of back pain, and the type that most people struggle with more, which is pain over the spine, or if you want to look at it in terms of TCM, pain over the dumai. And the way we're going to do this is to image the full dumai just on points on the scalp over the dumai. So as you can see here in the image, you will start from do 24 and go all the way to do 16. And the image will be, the head will be more or less around the area of do 24, and the spine will go on. Around the area of do 20 you will have the beginning of the lumbar spine, and you will go all the way to do 16 where you have the coccyx. So all you have to do is locate where the pain is on your patient, use this image and look for ashe points in the area that corresponds to the image. I will give you even a bonus trick, which is if you have more than one point that are close to each other, instead of inserting individual needles, you can thread the needle between the 2 points, and this will be as if you're covering the whole spine. As you can see in this video, you will locate the point and then angle the needle in a way that you can thread the 2 points. If doing this technique correctly, the needle will go in without any resistance, and it will not be painful for the patient, but it will be very helpful for your treatment. And you can do this all along the area that we defined on the dumai, on the scalp of the patient. And with this we have 3 amazing tricks to help you treat back pain. We saw a fantastic trick for lower back pain, we saw a fantastic trick for cervical pain, and we saw a trick to help you treat any kind of pain over the dumai. So I hope this is very helpful to you and that it will improve your results. Thank you so much for watching. If you like this video, don't forget to like and subscribe, and share it with your contacts so they too can learn about this.